My name is Shubham Grover. I am the growth and insights lead for NIVI. I'm based out of India. NIVI is a digital health company that was founded in 2016 that focuses on providing on-demand, trusted, and actionable health information and enables individuals to make informed choices about their health. Companies like MSD, PSI, Population Council, 90 Innovation, Arc Venture Studio, Tata NMG are some of the leading organizations that use NIVI to reach, engage, and serve health consumers in a variety of therapeutic areas. So I'll be your MC for today's session. We're thrilled to have participants coming in from the social sector, from pharma companies, from peer companies, and other public health organizations. That kind of showcases the diverse interest in our topic today. Moving on, we're going to do a deep dive into a real-world case study from NIVI and its partners from the work in Kenya around raising HPV and cervical cancer awareness. And we're going to talk about how, along with the partners, we've built an innovative financing solution that covers the HPV vaccine as well as preventative screening services for female cancers. Our goal for the webinar is to share our learnings and insights that we feel will help drive cervical cancer elimination in practicality. And even beyond that, we want to demonstrate how and why we've come to a solution that can nearly be applied across all therapeutic categories where accessibility poses a challenge to improved health outcomes. So I encourage you to use the Q&A section as we move along the different sessions of the webinar. You can ask your questions to our guest experts here, and we have some time dedicated near the end to do the Q&A to take these questions up with them. Moving on to just introducing our speakers, I'll do this in the manner we have the sessions organized as well. Starting off, we have Sid Goyal, who is the co-founder and CEO of NIVI. Sid's based out of the US, and he's joining us early in his morning in the US. We also have Ben joining in, who's also co-founder and the chief business officer at NIVI. Ben's also joining us from Boston. We have Priya as well as Anaga, our colleagues based out of India here on the webinar as well. In the guests, we have Dr. Ratna Devi, who's the CEO of Dakshama Health. She's a medical doctor, a public health management professional, and brings about 30 years of experience working to improve health outcomes here in India. Dr. Ratna's organization is dedicated to working and making health accessible, as well as her organization works in patient education and advocacy. Dakshama Health aims to create a network of caregivers and patient groups and works with them on knowledge sharing as well as providing essential feedback for managing health issues and diseases. As a strong patient safety advocate, she works with the government as well as with patient organizations to advocate for efforts that will improve health outcomes for the populations. Welcome, Dr. Ratna. For the attendees, Dr. Ratna will be having a conversation with Ben on uniting efforts for change. What's the role of different stakeholders regarding the topic of the webinar today? Ben, Dr. Ratna, I'd like to call you folks on the floor. Please, let's get started.
Great. Shubham, thank you for the intro, and I appreciate having the WhatsApp quiz. Dr. Ratna, thank you for joining us today. It's great to have you here.
Thank you, Ben, and thank you, Shubham. Sorry. Thank you, Ben, and thank you, Shubham, for that kind introduction.
Fantastic. Well, great, and great to have you here. So I wanted to be able to set the stage and set today's conversation really around contextualizing the landscape. Give us a sense of the magnitude of the challenge we see before us. And if you could, recognizing that cervical cancer is one of the leading causes of death globally for women of reproductive age, that the burden of disease is significant in emerging markets and frankly, many parts of the world. If you could just speak to the gravity, the significance of the challenge ahead, and give us a sense of why this is important.
Thank you, Ben. A very important question. And we know that globally cancer rates are rising every year, and so more so in cervical cancer, which is a very preventable disease. And we know that there are around 500,000 cases annually and more than 300,000 deaths in women to something that is absolutely preventable. And this indeed is a cause for concern.
No, it is. It's a challenge, and from where you're working with government, with patients groups, with patients themselves, this is a significant challenge that these various groups face. Getting the vaccine into solutions in hand, then, could you speak a bit to the challenge around awareness, around speaking to different interest groups and seeing that solutions at hand are actually taken up?
Thank you. And awareness is a very big challenge, and it's not just the awareness, but also very low vaccination rates, which could be linked to awareness. So many people do not know that this is preventable and that early vaccination can prevent the disease, especially if you give it in young boys and girls. Also, late detection, because women do not report to doctors even though they have signs and symptoms. They do not know how to recognize that they may be at risk to cervical cancer, and therefore they do not report to doctors. There is low health literacy in many of the low and middle income countries, and even lower digital health literacy. So people do have access to mobile phones, but they are not familiar with using digital technology to be able to run simple checklists to know whether they are at risk or not. And while the HPV vaccine is included in many government schemes, people do not see the importance of getting themselves vaccinated and therefore do not turn up at clinics which offer these services. Also, when children visit pediatricians for other reasons, pediatricians themselves sometimes do not recommend the vaccine. So there is a low awareness across the spectrum from service providers to the mothers and children themselves.
Wow, that's a lot of challenges ahead. So there are challenges with low awareness, there are challenges with low screening rates. And then on top of that, there are these social or societal barriers, cultural barriers that could be playing a crucial role in both setting in stymieing or presenting the challenge, and then also blocking or presenting challenges and rolling out solutions. So with that, recognizing the various barriers, challenges at the individual kind of group level, there are roles for various stakeholders to address some of these challenges to improve the current situation. I was wondering if you could speak to the role of parents and the role of public sector here in addressing that low awareness, those low screening rates. What can we do as parents? What can government do to ameliorate the situation?
Thank you, Ben. And again, a very, very important question, especially in the context of low and middle income countries where there are gender disparities in access to healthcare. So traditionally, women and young children who are girls do not really get the same level of access as boys and men do. Also, there is a lot of taboos and stigmas, as well as myths and misconceptions around women's health, which prevents mothers taking their children to, say, a pediatrician or a gynecologist for vaccination or even for a routine checkup. Given this, I think parents have a very big role to play with the right kind of awareness programs on the importance of prevention measures through easy uptake of vaccination, which is available so easily within the government systems these days. And all they need to do is to make an appointment and get the vaccination. As for the government, the vaccination has to be made available. There has to be information on where these vaccination centers are so that people are not searching around for those centers, and it could be part of a routine immunization program. So when you go for other vaccines, you're also advised the HPV vaccine. In terms of hospitals, I think the healthcare providers that children and women visit need to be able to advise them to take those vaccines. So even if it's a routine visit for a fever, I think the checklist should include, are you vaccinated for HPV? And if they are not, then they should be advised for that vaccination. In terms of manufacturers, they should be able to provide vaccine at available cost. And then, of course, there's all other stakeholders like the insurance, the technology, etc., that can add value to all these stakeholders who are making the environment more friendly for vaccine uptake.
You've kind of anticipated my next question, mentioning private actors in the private sector. I think, but I first want to acknowledge, as a parent myself, what you're saying resonates certainly on the role of parents, of caregivers, in actively taking children for routine vaccination at that critical age where they're age eligible for the vaccine. And that's addressing a certain segment. This works certainly in the public health system, making it readily available. But there's a role here in the private sector, and you alluded to that in your comments here. And I was wondering if you could expand on that, thinking about other age eligible cohorts of vaccine eligible individuals. What's the role of private sector in catching up and addressing the needs of young people around access to the vaccine?
Young people these days, and they always have been very, very curious. So they are always searching the net for information. I think one of the largest roles that the private sector can play is to make that information accessible through easily available platforms, so that girls or boys or even older women and men who are searching for this kind of information are not searching websites that are not providing accurate information. Also, once that information is available, it should be in an easily readable and understandable format, maybe through an app or through using mobile technology or social media, for example, because these are some of the platforms that the large masses access. Creating those platforms that are easily accessible could be another way, using chatbots, for example, because many people are asking questions and searching the web using those questions. So if there could be a question bank that one can curate from some of those searches that young people are making or even other people are making, and then you create a chatbot so that those questions are answered, then people are not wasting time or not going to sites that are not authentic, and not going to places that are not offering them the right kind of healthcare.
Those are great points, and I'm glad you brought up digital. It's certainly it has a role in being present where and when people need the information. And it's not simply a matter of searching for information, but also then generating results that are meaningful, high quality, and actionable for users. So I thank you for raising those points. It does feel like the future is digital. Now,
If I can just add one more
yeah.
point, Ben, I think a lot of times there's information available, but not in a format that could be understood. So, for example, local context and diseases are referred to in local languages or local contexts, and those kind of language barriers can be overcome through the private sector. We could use technology like the QR code that we just had to be able to redirect people to a particular website where you can choose what you want to see and then run a questionnaire to see whether you are at risk for a certain kind of cancer, in this case, cervical cancer. And if you check a few points, what do you do to eliminate that risk, or where do you go? Who is your healthcare provider who can help you? What kind of specialty deals with this kind of thing? All this information can be provided in very easily available formats. However, nothing of that kind exists. There is a lot of information, but it's all very fragmented. It's not in one platform. So a single platform that provides this kind of information would be extremely useful.
Oh, fantastic. I think those are great remarks, and it does help set the stage, both the magnitude of the challenge ahead of us and the potential, the promise of various solutions coming together in a more coordinated fashion in a digital ecosystem. I really thank you for those remarks. I think,
Thank you.
Shubham, over to you. This helps set the stage for some of the following conversations here.
Absolutely,
Thank
Ben.
you.
Thank you. Thank you, Dr. Ratna. Thank you,
Thank
Ben.
you, Ben.
That was an insightful conversation. I think what I'm taking away from your chat is being present and being able to meet young people where they are is probably the only way to actually make a difference. And I think it would definitely help enhance some of the other topics that we're now going to talk about as well.